A bill pending in the Illinois General Assembly seeks to expand access to a federal discount drug program, and it could end up costing Illinois employers millions each year. Capital News Illinois reports the program provides discounted drugs to hospitals and clinics that treat a large volume of Medicaid patients. A memo from the Illinois Department of Central Management Services estimates that passing the bill would raise costs on employer-based health insurance plans in Illinois by $89 million a year. That includes just over $12 million in additional costs for the State of Illinois Group Insurance Program. Supporters of the bill say it would benefit community health care centers and rural hospitals. The bill passed the Senate during the 2025 legislative session. It is still awaiting final approval in the Illinois House.